Now here is a list of some of the most common symptoms associated with allergies and sensitivities. Sinusitis, acid reflux, irritable bowel syndrome, gas, bloating, diarrhea, hay fever, asthma, wheezing, sneezing, rashes, itchy eyes, eczema, skin rashes, hives, dermatitis, headaches, and migraines. Have you ever heard of something called occupational allergies? This is where people from their work environment suffer from allergies due to the wood or latex, copier inks, flowers, chemicals, and raw food enzymes around them. We had a patient in our office. She had to quit working because she was so allergic to the flowers at her school that she worked at. She was a teacher, and she couldn't go to work for that reason because she would literally pass out when she was exposed to those flowers. She's back to work now and functioning completely normal. Give you another example. There was a nurse in Denver she was about ready to quit her job from severe skin reactions to latex. Well, after one treatment, her lesions went away and she was able to return to work. How happy do you think these women were that they were able to keep their jobs and continue life the way that it's supposed to be? Now going back to some of the symptoms of allergies is something called sinusitis. Sinusitis is the most commonly reported chronic disease affecting nearly 32 million Americans today. There are very few treatments available that can successfully treat sinusitis. Drug therapies, they're only temporarily reducing the symptoms, and many patients that do surgery report temporary relief after their surgery procedure was done, and the results that were achieved were very, very short term. AAR of AZ maintains a very high success rate in treatment of this sinusitis because we have a lot of stuff in our system that are common culprits to it. Another common symptom of allergies and sensitivities is something that most people aren't aware of. Is called IBS, or irritable bowel syndrome. Irritable bowel syndrome is a disorder characterized most commonly by cramping, abdominal pains, bloating, constipation, and diarrhea. As many as 20% of the adult population, or 1 in 5 Americans, has symptoms of this IBS. In fact, it's one of the most common disorders diagnosed by medical doctors. The etiology is typically unknown in conventional medicine. However, a Rush University medical study found that the likelihood of IBS was significantly higher in patients with foods and airborne allergies, including things such as eczema and depression. In our office, we maintain a very high success rate of treatment of this IBS. Another common symptom of allergies and sensitivity is something called acid reflux, heartburn, or GERD. It affects nearly 1/3 of the adult population of the United States to some degree at least once a month. Almost 10% of all adults experience this acid reflux or heartburn on a weekly or even daily basis. In fact, infants and children are actually being diagnosed on a daily basis as well as having this. Some medications used to help it are proton pump inhibitors, and they act by irreversibly blocking the proton pumps of the gastric parietal cells, so you basically don't make acid. By the year 2000, Prilosec was the most commonly prescribed drug in the world, with annual global sales reaching $6 billion. And once traditional methods have been started for GERD, it usually will be need to be continued indefinitely unless you do something to break and reset your nervous system, such as using the Bax 3000. Now, believe it or not, many patients have allergies or sensitivities to vitamins and minerals, which can cause many symptoms from many foods. This is primarily due to people taking cheap synthetic garbage. Sorry to be so blunt, but when you buy cheap supplements, you know the ones you get and you can spend like $10 for a 6-month supply from your local stores here? Well, folks, you get what you pay for. And what happens is, to make these cheap synthetic vitamins and minerals, you have to use a lot of different chemicals, high heat, and other bad processing methods that we talked about earlier that can lead and cause these allergies. So what you're left with is basically potentially an allergy-causing pill. Now, what I recommend is once we reprogram your nervous system, if you're going to be taking these vitamins and minerals, try to purchase whole food nutritional supplements, things that you recognize the ingredients because they're coming from foods, not things you can't recognize. We carry some in our office, but there's many others out there as well. Now, when you have allergies or sensitivities, there's 4 main types of reactions that can take place in that process. One of them is immediate IgE responses, where we release histamine. This accounts for about 10 to 15% of allergic responses. Another scenario is allergic substances unite with very healthy cells that our own body's antibodies end up fighting. They end up then destroying the good healthy cells. This is very common in the intestinal linings. Another one is allergic substances actually attach to and destroy these antibodies, causing an immunocomplex. They then attach to other healthy cells and tissues, and then they start destroying those other healthy cells in other tissues as well. And then we have something where the special cells, such as our T cells, become stimulated, causing a type 4 allergic reaction, leading to a lot of inflammation at a specific site. This is very common with things like poison oak or poison ivy, as well as a lot of lung issues with things from pollens. Speaking earlier of the IgE response, traditional medicine through skin and blood tests typically check for what is called that IgE histamine response. This is an immediate response that is typically common to things that you already know you have, such as when you eat a certain food and you instantly develop a rash or get an itchy throat, or when you're around a cat and your eyes begin to itch. These are immediate reactions. Now, did you know that only 5% of your symptoms of allergies and sensitivities are coming from these IgE responses? And that 90% of all IgE food reactions stem from these 8 foods: eggs, dairy, soy, grains, nuts, sugar, fish or shellfish, and corn. The other 95% come from an IgG response, in which medicine typically does not test or treat for these. These are reactions that typically take up to 72 hours to develop and account for, like I said, nearly 95% of all health conditions. They range from headaches and eczema to asthma and heartburn or even irritable bowel syndrome. And that is what the BAX 3000 tests for. It's checking and testing for these unknown allergies that you may have. And of course, we reprogram your nervous system to these immunoglobulins as well. There are many different treatment methods available for dealing and coping with these allergies and sensitivities. Of course, we have the allopathic or medical approach, in which you spend a ton of your time, life, money, and energy chasing and coping as best as you can with your symptoms for pretty much the rest of your life. Some examples of these medications are Flonase, Claritin, Zicam, Nasonex, Allegra, Astelin, Clarinex, and Singulair. Then, of course, you have the options for allergy shots, in which you involve many weekly visits for up to 5 years. Of course, I've seen many patients that have done allergy shots for over 20 years, believe it or not. Now, this is not only quite costly, but it also takes a lot of time from your life and your energy, and just the inconvenience alone is huge on that. I got some information on Benadryl, and these are what I call effects. They like to call them side effects, but I call them effects of the Benadryl. And some of the most concerning ones that I wanted to mention are increased chest congestion, sleepiness, an upset stomach. Then some more severe ones are anaphylactic shock, convulsions, headaches, hives, irregular and rapid heartbeats, rashes, ringing in the ears, stuffy nose, tightness of your chest, and even wheezing. And here are what I call the effects, or what they call the side effects of Singulair. Some of the less severe ones may include upset stomach, heartburn, which then you're going to take medications for the heartburn, headaches, of course you'll take pain pills for the headaches, tiredness, sore throat, a chronic cough, and nasal irritation. Some more severe side effects include you can have an allergic reaction which causes difficulty breathing or closing of your throat. You can also get pain and swelling of the sinuses and even worsening respiratory symptoms. So is it just me, or are these medications, side effects or effects, whatever you want to call it, actually the same symptoms that people are actually trying to chase and treat with these medications? With all these side effects, why are they prescribing all these medications? Did you know that the pharmaceutical companies spend over $30 billion every year on, guess what? Not research and development, but marketing. We are all instilled so much to believe through TV and print and radio and other sources that medicine is needed and good for us. Of course, allergy medicine is one of the largest prescribed businesses or medications for the pharmaceutical companies. But I'm sure most of you believe, as I did, that once you have allergies, you'll have them for the rest of your life. And this is exactly what they want you to believe in, because you'll keep coming back for more and more medications and have more and more problems. Did I forget to tell you that the pharmaceutical companies are in business to sell more drugs, not to fix or cure you? Of course, it's hard for me to get this across to you because you have been bombarded for your entire lives about the needs of these medications, especially for allergies, all the while I get to show you over the next few minutes here or in the next video, how there is an actually alternative. It really seems like it's too good to be true, so why wouldn't they want us to know about this alternative? It's quite simple. It's because these are majorly publicly traded corporations, and they're in business to sell more and more drugs, not cure. If they did cures, stocks would plummet and businesses would fail. Fortunately, more and more people are becoming more and more aware of these dangers of these medications, and they're looking more towards natural approaches and what can be done. Of course, the medical community completely frowns upon this. The three main things that can be done are, first off, if it's at all possible, you can avoid what you're having an allergic reaction to. Sometimes you can't avoid it, but you do the best you can, and some people even get fixed after many years of doing that. Next, you can and would have to spend the rest of your life and hard-earned money taking dozens of immune-boosting supplements on a daily basis, which in my mind is definitely better than taking medications, but it's still not the answer because it's not fixing the problem or the cause of what's going on. And then, thanks to modern advancements, we now have the best known, easiest, safest, and long-term option available to us, and this is what we do here at Advanced Allergy Relief of Arizona. We desensitize or reprogram your nervous system through positive conditioning by use of the BAX 3000. Now, if you've been treated and had your nervous system reprogrammed, or you don't have very many allergies or any allergies at all, there are some steps that you may want to take to help prevent future allergies from occurring on you or your children. One of them is breastfeed for the first 6 months of your child's life, and don't give them solid foods until then either. Chew your food all the way before swallowing because poor digestion starts with not chewing properly, leading to something called leaky gut syndrome. Avoid taking medications, especially things like aspirins and alcohols and ibuprofens and antibiotics. Avoid exposure to environmental toxins, medications, like I mentioned earlier, and vaccinations. These cause a lot of different immunocompromised situations. They can also cause a lot of yeast and bacterial overgrowth, leading to, again, leaky gut syndrome. Limit your liquid intake while you're eating. This decreases your pancreatic enzymes and allows you to swallow your food before it's ready to be swallowed. Take enzymes, hydrochloric acid, and probiotics to aid with digestion. Introduce a change or interesting variety of foods. Don't eat the same thing every day over and over. This can possibly lead to other allergies too. Try to eat as much organic, pure, fresh fruits and vegetables as possible, and stay away from the processed, refined, fast food type of foods. Try to get some exercise in on a weekly basis, and of course, maintain a strong and healthy immune system. Here are some of the most common and most important nutritional supplements needed for optimal health and wellness. We primarily use NutriWest products in our office due to their high levels of purity, potency, quality, and testing standards. First, we have DSF, which stands for De-Stress Formula. This is used for your adrenals, which kind of help control and regulate everything else in your body. Then we have C-Aloe. This is nature's or the world's best nutritional whole food multivitamin supplement. There is really nothing better. You can find this at www.fosterscialoe.com. Then we have Complete Essentials. These are essential fatty acids that are derived from different fish sources. Very good for healing properties. Then we have Total Enzymes. Next, Total Probiotics. Then we have Yoli. Yoli is basically a drink that you can have that is not refined and processed and have artificial flavors and ingredients in it. So it's an alternative to having to drink water, but also getting a healthy juice in. You can go to www.buyhealthyjuice.com to learn more about this. And then we have 3 other additional ingredients or supplements that are needed for some people that are on more extreme cases. One is called Hypo D. The next is Total Leaky Gut. And then the next is called Total Yeast Redux. And these are all for probably mostly major digestive disorders. For more information, please go to our website at www.becomeallergyfree.com. Thank you very much for watching this video, Allergies and You. We hope you enjoyed it and hope it was educational for you, and we look forward to seeing you at our office here at Advanced Allergy Relief of Arizona.